Hi, I'm Dr. Rick Rieser. I'm here to talk about PTSD tonight. PTSD is a change in the brain that occurs when you become afraid for your own life or the life of a member of your own clan. So when I'm interviewing you as a physician, I ask you if you have anxiety and depression that's event-related or if it's something you grew into. If you tell me that it's event-related, the next thing I ask you is, are you having nightmares behind that event? If you say yes, then I've got you with PTSD. Again, PTSD is a change in the brain that occurs when you're afraid for your own life or the life maybe of a family member or even a dog. Those who know Steve Irwin's work know that Steve Irwin, if you can look up his video footage about when he lost his dog, he has PTSD also. And anybody that is interviewed about World War II, especially those people that fought on Normandy Beach, every one of them have PTSD. PTSD is mostly the focus of therapy, the way PTSD is presently, is to have you speak and explain and talk over the event over and over again. And I don't believe this is helpful because PTSD is a hardwired event. It's a change in your brain and it doesn't unchange. The nightmares never go away. Therapy should never, so I don't want you to ever again tell the story of how you got your PTSD. It's not important. It's not going to help you. One-on-one therapy, if you can find a one-on-one therapist who has PTSD, they'll make a great drinking buddy, but they can't do your therapy. Therapy, if I were to read every book on PTSD, I would still know nothing about it. I don't have it, I don't know anything about it. But you are the expert in PTSD. So what I'm urging all of my patients to do is to get together with other experts, and that means group therapy. Group therapy is very difficult for people with PTSD, obviously, because by and large, most patients don't want to be in any kind of therapy. They don't want to be with any strangers. But if you appreciate that everybody in group therapy, in a PTSD group, feels the same way that you do, that they're afraid to be in therapy, then you will do much better in your therapy in knowing that everybody there is afraid to be in a group, and you have to get into a group, and you have to learn to trust everyone in there. Group therapy is very good if you, because what happens in group therapy is you end up falling in love with everybody in the room. And I urge you to do that. You've got to want everybody in that room to improve. In group, I have been in many kinds of therapy, and group therapy is certainly better than one-on-one therapy. And the reason is because in group therapy, you can lie to the group, but you can't lie to yourself. If you tell a story and then you have something that contradicts that story in 2 weeks or 3 weeks after you've been in there, the group will say, but wait a minute, you said this at that other time, and well, you should be, what do you think about that? And then you can say, well, maybe I am lying to myself about that. So group therapy is what I'm urging you to do. And when you get in group therapy, I want you to concentrate on what to do about the triggers. My practice in medicine right now is heavily based on prescribing medical marijuana. Medical marijuana is extremely helpful in helping you not remember your dreams. So the nightmares that you have, some of you nightly, the nightmares that you have, they won't be bothering you. Or as my brother, the psychiatrist, says, that's because pot smokers don't remember anything. But it's a very nice thing that pot does that for people that are having nightmares. It's the daytime triggers that you have to live with. It's not being able to go to the grocery store when it's 5 o'clock in the evening, or not being able to sit at a restaurant unless your back is against the wall, and that's after you've checked out where every exit is. Group therapy is, hopefully I have one patient who is a Vietnam War veteran who after 2 years of group therapy with the same people, walks down the street with an imaginary tennis racket in his hand, swinging it back and forth, going, "That was a trigger, that was a trigger," and he knocks them across the street. However, that guy was able to go to opening night of Star Wars last year, and he was able to go to the crowded mall on Christmas Eve just to look at the girls. He's 66 years old. That guy has gotten over his PTSD. He hasn't gotten over the nightmares. And he was the one that told me the nightmares never stop. But he has gotten over the daytime triggers. He's learned how to cope with it. Now I did have another patient this year that told me that he had been hypnotized. And I don't know much about hypnotism and this issue, but I do know that most of the people that I've talked to that have been in group therapy have done very well. Another thing I want to share with you is dogs. Why and how human beings and dogs hooked up, I have no clue. However, dogs are extremely tuned in to human emotions. Anybody with PTSD that has a dog knows the dog. Some dogs will teach themselves to wake you up when you're having a nightmare. And I know the dogs can be taught to do that, but for them to do that on their own just goes to show how tuned into humans they are. So caring for a dog, if you're the primary caregiver for the dog, you're the one that lets the dog put his head in your lap, you're the person that feeds the dog. That's a very good relationship to have. And I want to warn you about another problem that PTSD patients have. And that is with children. Children need to be able to touch their parents whenever they want to. A 3-year-old has to be running around the room like crazy and then come up with their arms like this and put them right on your legs. And you can't flinch. You have to let them melt right into your legs. And if you're the kind of person that has problems being touched after you have your PTSD, this is something you have to get over if you're planning to be a good parent. Okay, so in conclusion then, I know that there's been some therapy processes where they want you to follow their finger and they want you to repeat this story over and over again. I just don't believe that works. I think the people are very well-meaning, but I think that they are way out of touch with what's really going on here, which has nothing to do with your getting over it. A 3-year-old can fall off a tricycle, skin their nose, skin their elbow, skin their wrist, and then cry it out within 20 minutes. This is not the same. This is sheer terror. And human beings are not the only ones that get this. Dogs get this. A dog that's been separated from its partner in combat, and if the dog experiences the death of that soldier, the dog is no longer a functional soldier for the military. The dog cannot just trade partners. Some people, especially in the military, some people, when they get separated from their dogs, that's enough to cause PTSD. PTSD is very, very widely experienced. Dogs get it, like I said, rats get it, and I'll wager that every animal in one way or another gets PTSD when they're afraid for their own life. Okay, so in conclusion, then, I want you to consider group therapy. I want you to consider getting into a group that is that you're going to be able to fall in love with. The way to find a group in the civilian population is to go to the health department of any county that you're living in. Go to the health department, and when you get to the health department, have them shuffle you towards the mental health department, the mental health desk of the health department, and there you will find a middle-aged, usually overweight woman. It's okay. And when you ask them, I want to get into group therapy for PTSD, the first response that you're going to hear is, oh, I have 3 names. I have 3 names I can give you right here. And that's the person you want to run into, because you run into that person and then you want to write down all 3 names. Revisiting my PTSD veteran, he was in 3 groups before he got into a good group, and he said that the best group is a good group leader and a good group of people. And you need the combination of those two things in order to have a successful group. So when the little old lady gives you 3 names to call all 3 of them. Join all 3 groups. Stay with the one that absolutely you like the best and drop the other 2. But try to get some therapy for your PTSD.